We created this video to provide examples of the simulations from the workshop to help you practice using the Interpret Framework and Facilitator Training Guide. The portions of simulated encounters that you will see are reenactments of interactions from the bad breath case. All scenes are staged to emphasize communication between providers, interpreters, and patients, rather than duplicating dental settings. Similarly, the interpreter and providers are the only individuals who are microphoned, as the emphasis is not on the quality of the interpretation itself. The video is based on actual learner performance in the simulations, and it is intended to provide examples of both positive skills and opportunities for improvement. This is not a gold standard video. It's a training tool to promote focused observation, reflection, and discussion. At the end of each segment of the patient encounter, you'll have an opportunity to share your observations with each other, practice role play to facilitate the timeout discussion based on the interaction that you just watched, and then see a portion of a facilitated timeout. The facilitated timeout is provided to demonstrate the use of advocacy inquiry and to address some of the dynamics in the patient encounter. It is meant to be a sample of possible conversation.
Hi, my name is Sam. I'm the dentist.
Hola, mi nombre soy Sam, soy el dentista.
Hi, I'm Sam. You must be the interpreter?
Hi, yes, my name is Adriana, and I am the interpreter, and I'm just going to quickly tell you how is this going to work.
Okay.
I'm going to interpret everything what you say in English to her in Spanish.
Okay, in Spanish.
And everything what she says in Spanish into English for you.
Okay.
I'm going to keep everything confidential, and I'm going to tell her what I just told you.
Perfect. Thank you so much for interpreting for us.
My pleasure. Le voy a decir a usted cómo va a trabajar esto. Voy a interpretar todo lo que usted diga y todo lo que él diga en inglés y en español y viceversa. Todo va a ser confidencial. Okay?
I'd like to start by addressing the interpreting. Do you have a preference of how long I should speak or anything like that?
Él me está preguntando a mí que si tengo alguna preferencia de cómo es que él debe de hablar. I just told her I just interpret what you said, and let's give it a try. If I need you to stop, I'm going to raise my hand. Okay. Or if you're going too fast or saying a lot of things at the same time, I may going to ask you to repeat something.
Okay, perfect.
Perfecto.
So I guess I'd like to start by finding out why she's come in today.
Quiere saber por qué es que usted está aquí el día de hoy. Y también le voy a decir a él y a usted que por favor cuando hablen se dirijan directamente a ustedes y también se vean directamente como si yo no estuviera aquí. Voy a hacer su voz. So I just interpret what you said, and I also told her that I was going to tell you to speak directly to her and look at her directly like if I'm not here. So I'm going to be your voice.
Okay, it makes sense.
Tiene sentido.
So it's just the two of us now.
Ahora solamente estamos los dos.
What brings you in today?
¿A qué viene el día de hoy?
Tengo mal aliento en mi boca y también mal sabor en mi boca. Mi familia me está quejando que tengo mal aliento y también mi hijo no me quiere acercarse por eso.
I have a bad taste in my mouth and also I have bad breath. My family are complaining about it. Even my little child doesn't want to approach me because of my bad breath.
It sounds like that's causing some stress at home. I'm glad you came in, and we'll start getting a treatment for you.
Parece como que le está causando problemas en casa. Me da gusto que usted haya venido y vamos a empezar a hacer algo para solucionarlo.
I want to start by talking through some of your medical history. Did you get a chance to fill out that form that we sent you?
Vamos a empezar para hablar acerca de su historial médico. ¿Usted llenó la forma que le mandamos?
Sí.
Yes.
Do you have it with you?
¿La tiene con usted?
Sí.
Grab that from you.
Voy a tomarla.
Did you fill this form out yourself?
¿Usted llenó esta forma usted sola?
No, mi amiga Cristina habla bien en inglés y ella me ayudó con eso.
No, my friend, my neighbor, she speaks very good English and she helped me with that.
Oh, good. Did you have any questions about the form at all?
¿Usted tiene alguna pregunta acerca de la forma?
No.
No.
Okay, I want to look through it, see if there's any relevant medical conditions.
Voy a revisarla para ver si usted tiene alguna condición médica relevante.
It doesn't look like you have any current medical conditions.
Parece que usted no tiene ninguna condición médica.
No. Have you been tested for tuberculosis?
¿A usted le han hecho un examen para la tuberculosis?
Is there any chance that you might be pregnant?
¿Alguna posibilidad de que usted esté embarazada?
No.
No.
When was the last time you had an examination from a doctor?
¿Cuándo fue la última vez que usted tuvo un examen médico?
Ese es mi primer sitio de examen.
This is my first appointment this year.
Have you had any changes in your health in the last year?
¿Usted ha tenido algún cambio en su salud en el último año? No.
Do you have a doctor right now?
¿Usted tiene un doctor ahora?
No.
No.
Okay. So you know nothing with your heart at all?
¿Nada de problemas con su corazón?
No.
No.
Do you find that you bruise easily?
¿Usted encuentra que se hace moretes fácilmente?
No.
No.
Have you ever been diagnosed with asthma or have any breathing problems, especially when you exercise or are more active?
¿A usted le han diagnosticado con asma o algún problema de respiración o usted cuando hace ejercicio o está activa tiene problemas para respirar?
No.
No.
Does anyone in your family have diabetes or do you have diabetes?
¿Alguien en su familia tiene diabetes o usted tiene diabetes?
No.
No.
Okay. Are you taking any medications right now?
¿Usted está tomando algún medicamento ahora?
No.
No.
So there's no history of anything with your heart, any bleeding problems or clotting problems or like respiratory stuff?
Entonces usted no tiene ningún problema con su corazón, ningún problema de sangre o de coágulos de sangre o ningún problema de respiración. No.
Okay.
Let's pause for a minute to think about what you just observed and share your thoughts with each other. You might consider the following questions. What did you see that was done well in the interaction? What seemed challenging? Was there anything that surprised or confused you? Or did you see any components of the Interpret framework being used? What additional practices from the Interpret framework could have been useful in this encounter? Facilitators, you now have an opportunity to use role play to practice and develop your skills as a facilitator. To do this, assign roles. One of you should portray the learner and another person can be the facilitator. You can also include individuals as the patient and interpreter in the role play. Practice using facilitation strategies to explore some of the observations and issues you just discussed. So Sam, I thought that was a great encounter, and I really want to thank you for participating in that. I thought that was terrific. Let's talk a little bit about how that went. How did you think it went?
I thought it went okay. The introduction felt really awkward. I didn't know who to introduce myself to first, right? So it's like I introduced myself to the patient, but she doesn't speak English, so I didn't know if she could respond. And then maybe I should introduce myself to the interpreter first so she can interpret for the patient. What do you think I should have done there?
Well, I made note of that as well, so I'm glad you brought that up. It's a great question. Oftentimes, you'll be introducing yourself to the interpreter first.
Okay.
So that's perfectly normal thing to do. In this case, obviously, that wasn't the circumstance. And I also wouldn't assume that the patient doesn't speak any English at all. Oftentimes, patients are using an interpreter because they just don't feel as comfortable with English as a first language. But otherwise, I think you did a great job.
Okay. Yeah.
Any other observations that you had?
Yeah, I think the conversation overall went well. The progress felt a little slow. I noticed when I asked shorter, more specific questions, I got better information. But then she didn't have as much opportunity to respond, so it felt like we couldn't really build rapport.
Well, data gathering is always a really difficult part of these kinds of scenarios.
Right.
It's hard to come up with just the right level of specificity when you're trying to gather information from a patient. But I thought one of the great things that you did was actually asking her this question about how she actually filled out the form.
Yeah, it occurred to me that the form's in English, and even our English-speaking patients sometimes have a hard time filling it out well. Right. And she said that her friend helped her, which is, it's better than a child helping her, but I didn't know how much I could trust those answers. Yeah. So I didn't know, like, how thoroughly should I review the questionnaire in that type of a situation?
Well, I think you did a great job. And just as you're saying, you always need to verify how a patient completed the form and verify that they really understood everything that was included in there. So whether they speak English well or not, that's certainly a great practice each and every time.
I thought the interpreter made a really good point about speaking directly to the patient instead of to the interpreter. That was really helpful.
Exactly. And that's also one of the things that's really challenging. It's intuitive to look at the person who's talking to you, and it's just something that you have to kind of force yourself to do, to look at the patient each and every time, just so you can build a rapport with them.
Right. So now that we've talked through your medical history, I want to talk more about what brings you back into the clinic today.
Ahora que ya hablamos acerca de su historial médico, quiero hablar más acerca de por qué vino el día de hoy.
So you said that you came in because you had a bad taste in your mouth and people were noticing some bad breath.
Entonces usted dice que vino aquí porque tiene un mal sabor de boca y la gente ha notado que él tiene mal aliento?
Sí.
Yes.
How long has this been going on? When did it start?
¿Desde cuándo empezó esto? ¿Cuánto tiempo ha tenido esto?
Ya lo tuve por un tiempo y no me quita.
It's been a while and it doesn't go away.
Have you seen a dentist about this before?
¿Usted ha visto algún dentista acerca de esto? No.
Hi. Have you noticed any times a day where it's better or worse than others?
¿Usted ha notado si durante el día hay algunas horas en las que es mejor o está peor?
Siempre está aquí.
No, it's always here.
How often do you brush and floss your teeth?
Unas preguntas solamente acerca de lo dental. ¿Qué tan seguido usted se lava los dientes y usa hilo dental?
Pues limpio mis dientes a veces, pero no me uso el hilo dental porque me molesta.
Well, I brush my teeth once in a while, but I don't floss because it bothers me.
When you brush or when you floss, do you notice any blood in your mouth? Do you find that your gums are bleeding?
Cuando usted se cepilla los dientes o usa hilo dental, ¿usted nota si tiene sangre en su boca? ¿Ha visto que sus encías sangran?
Sí, a veces.
Yeah, sometimes.
Have you ever had a dentist give you special instructions on how to take care of your gums or express any concern about that?
¿Alguna vez algún dentista le ha dicho a usted cómo debe de tratar las encías de una manera especial o le ha dicho que está preocupado por sus encías?
No.
No.
¿Pero qué me está pasando? Soy preocupado.
But what's going on? I'm worried.
Well, the bad taste in your mouth and the smell is something we call halitosis. And based on the questions you've answered and the exam and the x-rays, I think you have slight to moderate periodontal disease, which can lead to the bad taste and the bad breath.
El mal sabor de boca y el mal aliento es algo que nosotros llamamos halitosis. Y debido a que lo que usted está diciendo, el examen que le hicimos en su boca y los rayos X, y déjeme clarificar con el dentista algo que no entendí. Excuse me, what is the name of the disease that you said?
Halitosis or periodontal disease.
Periodontal disease, thank you. Entonces, lo que usted tiene es una enfermedad periodontal leve a moderada y eso es lo que causa que usted tenga el mal sabor de boca y eso también lleva al mal olor.
It's nothing to be worried about. It's something that we can manage really well. You might know it as gum disease. What it is bacteria gets underneath your gums and can wear away at some of the tissue and bone around your teeth.
No es algo de lo que usted se tenga que preocupar. Tal vez usted ha notado que tiene una enfermedad en las encías. Y permítame otra vez checar con el doctor. I'm sorry, what did you say after the gum disease?
It's bacteria can get underneath your gums and it's kind of like an infection and it can wear away at the bone and the tissue around there, which could lead to like someone losing their teeth, which is why we really take it seriously.
Okay, esto es como una infección, es una bacteria que tiene usted abajo de las encías y esto puede hacer que el hueso se debilite y también que se infecte y pueda usted perder los dientes, pero esto es algo que podemos solucionar.
Let's pause again to think about what you just observed and share your thoughts with each other. You can continue to reflect on what went well, what was challenging, and what was confusing or surprising. Additionally, did you see the learner trying to incorporate anything from the first time out discussion? Facilitators, you have another opportunity to use role play to practice being a facilitator. Think about what went well in your first practice opportunity and, alternatively, what you'd like to try doing differently. Consider switching roles, too, so that you can experience the facilitated discussion as both the learner and the facilitator. So, what do you think, Sam? How did that go?
It's really hard to know when to pause for the interpreter, and it's hard to get a flow going. But I did feel like once we got into more of a rhythm, that it started to feel more natural.
Yeah. And that's to be expected. It is difficult to kind of develop a different rhythm, and like anything, it just takes practice. Was there anything else that was difficult or you felt uncomfortable with?
I mean, it's always hard putting things into layman's terms and figuring out how to articulate that, because like disease sounds scary. And when I said that, I realized, oh no, I shouldn't have said it that way. I should have explained that it's bacteria and then we can treat it, and been able to reassure her.
Right. Well, explaining things in layman's terms is always difficult. The important thing is providing the education to the patient, because it's the education to the patient that actually will make a difference in the quality of your treatment and the quality of your relationship with the patient. One of the things that you did that I thought was really great was your recognition of her nonverbal responses to what you were saying. That's so important in anticipating what the patient's going to need and what you think they're actually able to retain about what you're saying. Do you think you made a different choice with this patient because you were working with a Spanish language interpreter?
Yeah, I guess so. I think with my English-speaking patients, I really focus on like not dumbing anything down, really educating them on what's going on. But when I have an interpreter, I'm trying to think about how do I simplify it so that the information can get across.
Yeah, and that's something you don't necessarily need to concentrate on too much. It is important to try and use as little jargon as possible, but the really important part is the patient care. And if it just takes a little bit longer for you to be able to complete the encounter, that's totally fine. Okay. The important part is for you to build rapport and really provide the patient with optimal care that you're seeking to. The time investment in the patient's health is really what's worth it. Thanks, Sam. That was great. You know, Adriana, I really wanted to ask you what you thought about that encounter, in particular about the complexity and trying to relay some of that to the patient.
I really appreciate how the oral health provider was thinking about how the information was going to be relayed to the patient, Also, as an interpreter, English is my second language, so I do not know everything. So if I come across with a specific word of dentistry that I do not understand or any other words, I might ask you for clarification. So it's very helpful if you anticipate that as you are speaking, so everything can run more smooth. But at the end, we both have the same goal, the understanding. So I want you and your patient to understand each other. Sometimes I might use a translation tool on my phone to look up for a word. Or you might be, some words don't even exist in both languages. Maybe you are talking about a concept that I never heard before, and I might ask you to explain it in a different way. The more I work on a particular setting, the more I learn about the specific language and become familiar with those concepts as well.
Yeah, that's great. And I really appreciate that you said that. It certainly impacts the flow of communication. And I think the important thing is remembering that there's ambiguity in these kinds of scenarios, and that everybody needs to be a little bit flexible in order to make sure that you're working toward the same goal, which is just really optimal patient care. Mm-hmm. That's great.
Esa enfermedad suena tan terrible y no me quiero perder a mis dientes.
That disease sounds very terrible. I don't want to lose my teeth.
It can be a terrible disease if we don't treat it, but there is a lot that we can do to take care of it.
Suena terrible esa enfermedad si no la tratamos por eso, pero hay mucho que podemos hacer para quitarla.
¿Cómo?
Like what?
Well, I would recommend that we do deep cleaning, which we can do here in the office.
Yo le recomiendo una limpieza profunda, la que podemos hacer aquí en la oficina.
Oh, qué bueno.
Oh, that's good.
Yep. So deep cleaning is something that we call, or is also called scaling and root planing.
La limpieza profunda también se le llama raspado y alisado radicular.
And what we do is we take special instruments and we dig in around your gums to clean out the bacteria underneath there.
Y lo que hacemos es que usamos un instrumento especial y tratamos de hacerlo abajo de las encías para limpiarle la bacteria.
And that can sound kind of scary,
Y eso puede sonar terrible.
Sí, suena muy doloroso y no me quiero que duele.
Yeah, that sounds very painful. I don't want it to hurt.
I'm sorry, I meant that it sounds scary, but it's not as scary as it sounds. We have stuff that we can put on your gums to help it so you don't feel any pain.
Lo siento, suena terrible, pero en realidad no es tan terrible. Nosotros podemos ponerle algo en sus encías para que usted no sienta nada durante el procedimiento.
Bien.
Good.
So there's some things that we'll need you to do at home as well.
También hay algunas cosas que nosotros necesitamos que usted haga en casa.
¿Qué tengo que hacer?
What do I have to do?
Well, we'd like you to start brushing regularly, twice a day, flossing once a day, and then using a mouthwash that I can prescribe to you. Do you think you can do all of those things?
Bueno, necesitamos que usted se empiece a cepillar los dientes 2 veces al día, que use el hilo dental 1 vez al día y también que use un enjuague bucal que yo le voy a recetar. ¿Cree usted que puede hacer esas cosas en casa?
Puedo tratarlo, pero suena como mucho que tengo que hacer. ¿Y el enjuaga bucal?
I can try. It just sounds a lot. Did you say a mouthwash?
Yeah, I know it sounds like a lot, but all of those things can really make a difference.
Sí, yo sé que suena mucho, pero todas esas cosas pueden hacer una diferencia.
The good news is, if you are brushing regularly and flossing regularly, within a couple weeks, your gums shouldn't bleed anymore, and it can really help keep the disease from coming back.
Las buenas noticias es que si usted se cepilla los dientes regularmente y usa el hilo dental regularmente, esto puede ayudar a que la bacteria ya no regrese y sus dientes van a estar saludables.
Oh, bien. Entonces eso eliminará todos los problemas.
Oh, good. So then that will eliminate all the problems.
Yep, so it should take care of the bad taste and the bad breath.
Sí, eso va a ayudarle a lo del mal sabor de boca y al mal aliento.
¿Cuánto tiempo tomará?
How long is this going to take?
Well, let's talk about some of what you can expect. So it does take a little bit longer than a regular cleaning.
Ok, entonces vamos a hablar un poco acerca de lo que usted tiene que esperar. Esto sí toma un poco más de tiempo que una limpieza regular.
¿Y por qué es eso?
And why is that?
So what we'll do is we'll put some stuff on your gums to help numb the pain. And then we will, as we clean it out, we're going to do like one quadrant at a time. So we can do your upper right and your lower right and so on.
Entonces lo que vamos a hacer es que vamos a poner algo en sus encías para que usted no sienta el dolor y lo que vamos a hacer es limpiar 2 cuadrantes a la vez, por ejemplo el cuadrante superior y el cuadrante inferior a la vez.
Pero,
Y después seguimos.
pero le vas a hacerlo por toda mi boca, ¿verdad?
But you're going to do the whole mouth, right?
Right, so we'll do 2 appointments and do half of your mouth at each appointment.
Sí, vamos a hacer 2 citas y vamos a hacer la mitad de su boca en cada cita.
Bien.
Good.
Now that you've viewed the final portion of the encounter, let's pause for one last time to share your thoughts with each other. Think specifically about the skills you observed. You might also want to consider the broader challenges to patient care that you've seen emerge in working with an interpreter. Were there any takeaways or conclusions you came to from observing this interaction? Facilitators, in this final portion, think about how you might use facilitation to bring closure to the discussion. You might consider more broadly how the learners were able to provide patient-centered care. And you might also want to explore some of their takeaways. Did they have an aha moment from the experience? So Sam, I noticed that you responded when Lupita responded to the word scary. Can you say a little bit more about what you were thinking at that moment?
Yeah, so I mean, the conversation I felt like was going well until I ended with the word scary. And I realized that I misspoke and should clarify, but the interpreter had already started, so I didn't really know what to do.
Well, it was great that you reacted to that and you simply clarified what you were talking about. That's something that you also need to be mindful of with English-speaking patients as well. So it was perfectly fine the way you handled that. The basic thing is that you kept working toward common understanding, and that's what's really critical in working with the patient.
Yeah, I felt like to work toward that understanding, though, it took a lot longer than normal. Because normally I would, say all the information, but I'm trying to break it up so that it can be interpreted, and it's harder for me to keep my train of thought throughout the whole thing. So it didn't feel as smooth as it normally would.
But, by breaking it up, you actually gave Lupita a chance to ask more questions. And I actually think that that was really a great opportunity to open the door for her to guide the encounter. And that was one of the things I thought was really strong about that.
Yeah, I guess it did give you a chance to ask me more questions and for me to get a better idea of where my patient's at. It was tricky, though, because with the questions, I have my normal way of going through all the information, and when she asks questions, I have to reorganize it, and I missed an important thing about sensitivity to hot and cold, and but I'm also thinking with my English-speaking patients, maybe I too often do here's my paragraph of information when it would be helpful for them to break it up as well.
Yeah, that's a great point. Lupita, I was really curious about how that pacing worked for you as the patient.
I think working with an interpreter felt slower for me too as the patient, but I definitely appreciated how he, as the provider, took the time to sort of address things and for example, in reference to using scary about the deep cleaning, that he took the time to clarify that and then went into the steps of how the deep cleaning worked. It just really made me feel as the patient like he was caring for me genuinely and trying to make sure that I didn't feel worried about anything and that I was feeling empowered to really be a part of the process of helping to get through that.
That's a great point. And I think what you're bringing up is really about the importance of educating patients in order to address their concerns. And what you really did establish this sense of care and concern for the patient. And that's a critical part of this as well. I hope you found observing reenactments of different portions of the simulated encounter to be a useful experience. It's important to remember that the simulated timeouts were for demonstration purposes and not intended to cover all possible discussion points from the simulation. You likely identified and explored many other interesting and relevant observations in your discussions. And remember, so much of working together effectively across professions is about mutual respect and understanding one another's roles and scope of practice.